Good evening, everyone. It's great to see everyone out tonight. My name is Aaron. I'm the owner and pharmacist at Mainstreet Pharmacy and Wellness Center here in Kingsville. I'd like to welcome you to our second night on our PharmaWise Health and Wellness series, which we're doing in partnership with the Kingsville Community Center, as well as the town of Kingsville, who have lent us Unico Hall for the presentations. This evening, we're going to be talking about pain control, medication, and you. What can you do to help manage your pain safely and effectively? So we're going to cover a bunch of things tonight, but we're going to get in depth on some and give just good general information on others. So let's start with, what is pain? Really, it's physical or mental suffering or discomfort. Everyone thinks that pain is just a physical thing, but it impacts the mind as well and can cause a lot of other issues in relation to that. There's two main types of physical pain, which is what we'll be discussing mostly tonight. A somatic, which is that kind of body pain. Think you cut yourself or you break a bone. And then there's nerve pain, which is a burning sensation that you can get commonly starts in the feet and the hands and works its way up. It's commonly seen in patients who have uncontrolled diabetes, as well as other nervous system disorders. And one of the really important things to remember about pain is everyone experiences it differently. What may hurt me a lot may only hurt you a little bit, even if we were to have the exact same thing happen. And because pain is so subjective, it's very difficult for us to treat effectively and to monitor, because it's all about what you're feeling. It's not like blood pressure where we have a cuff we can put on you and measure your pain. Unfortunately, that means that we have to rely on how you're reporting it in order to effectively treat it. So if you're downplaying your pain because you don't want to sound like you're, whiny or worse off than you think you are, it means that we won't be able to effectively develop a plan to treat your pain. And without that plan, we're really not going to be able to get you pain relief in a safe and effective manner. And that leads us to our last point on this, is that treatment for pain is very personalized. What works for me might not work for you, and what works for you might not work for me. So when we're talking about pain, there's a lot of different things we can do for it, and treatment for each person is going to look very different. So what can we do to treat your pain? We've got acupuncture, massage therapy, chiropractic care, surgery, medications, and therapeutic exercise. Now, for the most part today, we're really going to discuss medications, which include herbal supplements, over-the-counters, and prescription medications, as well as therapeutic exercise. Acupuncture, massage, chiropractics, and surgery are all very specialized disciplines that, as a pharmacist, I'm not able to speak to effectively. But they very much have a place in care for pain management, as well as your general health and well-being, and they do have quite a lot of good effects and good benefits. So we'll start with, what medications can you use to treat your pain? We've got a whole list of things that we can use, and as you'll see on here, some of them really don't sound like pain medications. Why are we talking about antidepressants and anticonvulsants? Why are we talking about opioids, and why are we talking about synthetic cannabis? Because they are used to treat different types of pain, and we really specialize each different type of medication for what type of pain we're trying to treat. And as we discuss these and go along, I'll point out what types of pain we usually use them for. So the first thing we'll start with are anti-inflammatories. These are one of the most commonly used pain relieving medications in North America and probably the world. They come in two major categories: your steroidal anti-inflammatories and your non-steroidal anti-inflammatories. Now, your NSAIDs, some of them are prescription, but a lot of them are available over the counter. And They really do work, but the problem is you will find them in a lot of non-pain relieving medications. Think your cough and cold medications, some allergy meds, sinus meds. They all have, usually have either a Tylenol or acetaminophen base or an anti-inflammatory base. So you really need to watch what ingredients are in the medications you're taking, especially if you're taking anything chronically for pain, to make sure that you're not accidentally doubling up. One nice thing is for acute somatic pain, so acute body pain, muscle aches, strains, and sprains. In Ontario now, pharmacists are also able to assess and prescribe some of the stronger prescription-only anti-inflammatories, which may prevent you from having to delay care if you're already trying something over the counter and it's not giving you the relief you want, or without you having to, say, go and take up time in the ER to get those medications when you can come and see us and we can assess and prescribe for them if it's warranted. When we talk about our non-steroidal anti-inflammatories or NSAIDs, those are the medications like aspirin, ibuprofen, naproxen. Those are the ones that are majorly available over the counter. And then we have some prescription-only ones like diclofenac, celecoxib, or indomethacin, which are all used for different types of pain, as well as different risk factors. If you have certain heart conditions, we would choose to give you one over the other. If you have certain kidney issues, we may choose to give you one over the other, or none at all, depending on how severe your kidney issues are. One thing to note is that you can't compare apples to oranges here. Your dose of ibuprofen is going to look very different than your dose of naproxen. So it's very important that you do either read the labels or consult with a pharmacist or physician or nurse practitioner to make sure that you're not taking too much or too little, because taking too little will just leave you in further pain and lead to us having to maybe unnecessarily escalate therapy when we can just optimize the dose. Now, one thing that I really want to stress here is when you're using aspirin, if you're taking a daily baby aspirin for your heart, which a lot of people do depending on if they've had a heart attack or a stroke, and you're taking an anti-inflammatory, another non-steroidal anti-inflammatory like Advil, or ibuprofen, naproxen for pain, it's important that you take your aspirin first thing in the morning, because it's what we call an irreversible inhibitor. So it's going to do its job permanently, which is why we like it, to help prevent heart issues and further having a stroke or a heart attack. But the other NSAIDs, like ibuprofen, like naproxen, they are reversible. So if you take them first, they're going to temporarily do the job of preventing that heart risk. They'll take care of your pain, but then when you take your aspirin, if you take it after it, it's not going to have anything to work on. And by the time the other medication has reversed, you're not going to have any aspirin left in your system to help with that permanent help with the heart conditions. So that's something that a lot of people don't know and they don't think about when they're looking at the medications. They just say, well, aspirin's for my heart and this is for my pain. And they'll say, well, I got pain first thing in the morning, so I'll take my other anti-inflammatory and then I'll take my aspirin at lunch. Well, that really does lead to some potential risk. Lastly, we have an issue where a lot of medications and a lot of people want to take multiple things to treat their pain, and a very common thing is taking multiple over-the-counter medications. You can take acetaminophen, which is found commonly in Tylenol, but also in a lot of your cough and cold medications like Buckley's and NyQuil has acetaminophen in it. And you can take that with an anti-inflammatory. What you shouldn't do is take two different anti-inflammatories. So if you're prescribed diclofenac, don't take over-the-counter ibuprofen. If you're taking ibuprofen, don't pick up a bottle of naproxen off the shelf and take those together. That's where we can run into some significant side effects like increased risk of bleeding, as well as heart or kidney issues. Other than that, though, they are fairly well tolerated by most people. All we really say for the most part is take them with food, because anti-inflammatories, both steroidal and non-steroidal, can cause some significant stomach upset. When we talk about steroidal anti-inflammatories, we really have two that are available in Canada, are prednisone and methylprednisolone. Both of these require a prescription, and you'll see them commonly prescribed for non-pain issues as well. So you'll see them prescribed for breathing difficulties if you have pneumonia, or for like a rash if you've been out and got exposed to poison ivy, because it does really work for that. But when we're looking for prednisone for long-term, or methylprednisolone, we can use them in low doses for long-term to help treat pain for rheumatoid arthritis, as well as other autoimmune conditions that cause pain and discomfort. They are also used to treat TMJ, or temporomandibular joint disorder, which is the pain that occurs at the joints where your jaw hinges to the top of the skull. Now, we're lucky here in Kingsville that we do have a fantastic practitioner in Dr. DeJoya, who does treat TMJ very commonly and very frequently. And so we do see a lot of this in Kingsville just because of her practice. What we say about these is really, if you're going to be taking it long-term or at high doses, we want you to take it in the morning, because these steroidal anti-inflammatories have a stimulating effect, which can cause you to stay up and prevent you from getting sleep if you take them too late in the day. And as I said when we were discussing the NSAIDs, really should be taken with food to help prevent that stomach discomfort. Acetaminophen, which is in, as I said, Tylenol and a whole host of other over-the-counter products, as well as some prescription pain relievers like Oxycodone or Tylenol 3s have acetaminophen in them. It's one of the most commonly used pain medications in the world. Usually we dose it at 1,000 milligrams every 6 hours. We can go a little bit more or a little bit less depending on the form of acetaminophen we're using, but we really want to keep it at maximum of 4 grams or 4,000 milligrams a day. With certain liver conditions or alcoholics, we want to lower that to 2 grams, just because Tylenol is processed by the liver, and that can lead to side effects if you're not clearing it, or if you're taking too much, even accidentally, can cause significant issues. Now, acetaminophen and your non-steroidal anti-inflammatories both also help with fever. So that's why we'll commonly give them to especially sick kids who've got a high fever, to help bring down their pain and discomfort, as well as bring that fever down. The one thing to note is, while ibuprofen and acetaminophen are both perfectly safe to give to children as young as, newborns, we want to make sure that we are not giving them any aspirin until a child has turned 18, except in very, very specific circumstances, which will involve a specialist physician or nurse practitioner assessing them and prescribing it, because it can lead to significant side effects in children if they're given aspirin. Again, we really want to make sure that you're checking your over-the-counter products as well as your prescription medications if you're taking things for pain, to make sure that you're not going above that limit of acetaminophen, same as we want to look when we're taking any anti-inflammatories. Antidepressants and anticonvulsants, we use these more for nerve pain. We see it a lot in patients with fibromyalgia, as well as patients who are diabetic who have nerve pain, because they really help to slow the nerve conduction, which helps to reduce the pain. So if you go to your doctor and you're getting something for nerve pain and you bring it in, and then, I don't know, a lot of people are the type who like to go online and Google their medications, which is a good thing to an extent. You may see that you're like, well, okay, I went in for pain. Why did the doctor give me something for seizures? Or why did they give me something for depression? I'm not depressed, I have pain. And two things with that is, pain and depression often go hand in hand. So this may help even if you're not getting a lot of pain relief directly from it at first. It can help with the depression, which it's a kind of vicious feedback cycle where pain causes depression, depression worsens the pain, and it goes in a loop. Usually these type of medications are dosed once a day, sometimes twice a day, but often we want you to take them at nighttime, and that's because they really can cause significant drowsiness, some of them, and it's more just to be able to give you so that you're not feeling zonked out during the day if you've taken them in the morning. Really, the big side effects or the common side effects of these are dry eyes, dry mouth, potential weight gain, as well as some dizziness and constipation. And those are all because those medications kind of dry you out a little bit, and that dryness causes the constipation. It can affect your blood pressure a little bit when you first start or when you increase in dose, which can lead to that dizziness. But there's a lot of things we can do outside of even adjusting the medication to help you cope with those side effects if it's providing you adequate pain relief. Because one of the biggest things is quality of life. Pain is not a condition that's going to kill you. Pain is a symptom of something else usually that may, but the pain itself impacts your quality of life. It prevents you from doing the things you want, may keep you from going out with your friends or picking up your grandkids. And that's what really we're looking to treat the symptoms so that you can have good quality of life. So if it's working for your pain, we want to deal with the side effects in another way rather than taking away the medication that's helping with your pain. Muscle relaxants are available both over the counter and by prescription. They're very similar to the antidepressants in terms of their effects on pain as well as their side effects. So we're looking, usually we use them for neck and back pain, not really effective for any other type of pain. But when you're getting the over-the-counter methocarbamol, which is found in all of the over-the-counter muscle relaxants, it is very often found combined with acetaminophen, ibuprofen, or aspirin. So we want to really make sure, again, that we're checking all of the ingredients in what we're taking from an over-the-counter product to make sure that we're not accidentally taking too much of something. Muscle relaxants were really common for acute pain. We don't really see them used a lot for chronic long-term pain. Topical products, they're all available over the counter, but I'll put a little asterisk next to that when I say that the diclofenac specifically does have some prescription strength products that are available either commercially made or available to be compounded by a specialty pharmacy. But that's a little outside of the scope of what we're going to discuss today. All of these ones up here that you see are available off the shelf at your local pharmacy, including Main Street Pharmacy. The diclofenac, which is that one that also has some prescription formulations of it, both topically and orally, is an anti-inflammatory. It is a non-steroidal anti-inflammatory, and it's used to help reduce the actual inflammation that's causing the pain. So it's the only one that really treats the underlying cause, whereas when you're looking at the others, the methylsalicylate, menthol, capsaicin, camphor, those ones all overstimulate the nerves and they kind of confuse it. So it can't send a pain signal. So it kind of acts as a numbing agent that prevents that pain signal from being sent. So think about, you put your hand on a hot stove and immediately your body feels that pain, that heat, and sends a signal to your brain through your arm. That happens in every type of pain, and especially nerve pain is where we use these a lot because that nerve pain is constantly, instead of when you're touching something that's causing pain or cut yourself, it's basically constantly firing and sending a pain signal to your brain. So these confuse those nerves to kind of slow down that sending of the pain signal. They really just mask the symptom, which is good with pain, as we already discussed. It's about quality of life, not quantity. So masking symptoms is what we want to do if we can't treat the underlying cause, which with pain we often can't. For the most part, these are all used just as needed. Diclofenac topically, however, needs to be used regularly in order to see an effect from it. It's not something that you're going to slap on and get relief in 5 minutes, like you will with some of the others. It needs to be used regularly, 2 to 4 times a day, depending on the strength and formulation that you're getting. Because they are topical, there's fairly few side effects with these. We don't see a lot of systemic absorption, so we're not really going to see a lot of interactions with other medications. But the diclofenac can be absorbed, especially if once you put it on, you cover it with something tight or warm. That will increase the absorption of it over the skin, and that can lead to some absorption and other issues down the line with drug interactions. They can, because they are, capsaicin is the product that is in hot peppers. That's what gives them their heat. They can cause skin irritation, and if that happens, stop using them right away. And of course, because of that heat, you want to make sure that you're not putting them anywhere near your eyes, your nose, your mouth, or any other open sores or mucous membranes on the body. Herbal products are a very tricky proposition to discuss at best of times, but especially when we're discussing pain. That's because they're very rarely used alone, so we don't have a lot of data on how much they actually do compared to the other treatments that are being used with them. I've broken them down on the slides here by how they work, by the method of action. So we've got some herbal anti-inflammatories like devil's claw, cat's claw, and turmeric. We have some herbal antidepressants like 5-HTP, tryptophan, St. John's wort, and alpha-lipoic acid, or ALA. Then we have our supporting supplements like glucosamine, chondroitin, MSM, or SAME, or S-adenylmethionine. Now, these all work in the same ways we've discussed with the anti-inflammatories before, with the antidepressants before. So we're seeing similar how they work. We just don't know how well they work compared to the prescription medications and even the other over-the-counter medications that are not herbal supplements. As with the others, your anti-inflammatories like turmeric and devil's claw work a lot better for that body pain, that you've hurt yourself or you've got joint pain, arthritis pain. That's where we see those used more. Whereas your antidepressant type herbal supplements like the 5-HTP, the SAME, which is kind of works as an antidepressant and a supporting supplement, work better for nerve pain. When we look at these supporting supplements here, the glucosamine, chondroitin, MSM, SAME, what they really do is they help to support cartilage, which is the parts of our joints that rub together and hold the bones together, as well as the fluid between that wears out as we age and can cause grinding. So they help to slow the breakdown of that, but they don't really prevent the pain. They're more to help slow down the deterioration of the joint, say. So your shoulder hurts. If you're taking these supplements, it can help slow down how fast that cartilage and that fluid is breaking down, which will prevent the pain from getting worse as quickly. Now, one of the really big things with this is that dosages are usually very high. When we're looking at glucosamine or chondroitin, depending on the product you get, you may have to take 3 or 4 tablets 3 or 4 times a day to get an actually effective dose, which is why it's very hard for us to translate what we see in the studies to the real world, because the studies do show that they have some good benefit, but it's at doses that your average person is not going to take when they're buying it off the shelf. A, because it's expensive, and B, because these pills are usually quite large, and taking 3 or 4 of them 3 or 4 times a day just isn't practical for a lot of people. The other thing that's really important, and I really need to stress this, is a lot of these herbal supplements have a lot of drug interactions. St. John's wort is an especially notorious character that interacts with hundreds of prescription medications. A little off of pain topic, but on the herbal, other things that you want to watch out for are herbal supplements that start with a G. So garlic and ginkgo biloba all interact with a lot of medication. So it's important that if you are going to be starting any kind of herbal supplement, you consult with a pharmacist who has knowledge of the herbal products and how they interact with your prescription and over-the-counter medications. Now we're going to get on to the big bad of pain relief. Works really well, but has a lot of downfalls, and that's our opioids and our other narcotics. These are really strong pain relievers, and what's nice about them is, unlike acetaminophen, unlike ibuprofen, unlike all of these other medications we've discussed to now, they don't have a max dose. As long as we titrate you appropriately, we can keep going up on your dose to get you better pain control. Now, there will be a point where the side effects will outweigh the pain relief what we're getting, and then we'll need to look at other treatment modalities. And I can't say this enough, pain is not a single drug problem. It is not something that we can often solve, especially long-term chronic pain, by giving you one medication. It's quite common that you'll be on several different ones to help optimize preventing as many side effects from just increasing the dose on one medication. And they work in slightly different ways. So using them together, you get pain relief that's sometimes greater than the sum of the parts. So if you're giving just medication A, it'll get you this pain relief. And if I just give you medication B, it'll get you here. But instead of coming to this total of the two, we're going to see higher than that because they're working together and in different synergistic ways. Our opioids and opiates are quite often confused and talked about in the same manner, and they're basically the same thing. Opiates are the naturally occurring substance that's pulled from the poppy plant. So opium, morphine, codeine, and heroin are our opiates. And opioids are synthetic analogs of opiates. So thinking about hydrocodone, oxycodone, fentanyl, methadone are all synthetics, they're opioids. But what it really comes down to is not every rectangle is a square, but every square is a rectangle. Every opiate is an opioid, but not every opioid is an opiate. And really, when it comes down to discussion about what's best for pain relief and what's working well for you, it's not as critical a distinction in practice as it is in the science behind it. When we're looking at the narcotics category here, so your tramadol, nabilone, tapentadol, those products, the tramadol and tapentadol, have opioid-like properties, so they give you that opioid pain relief. But they also have some properties that are similar to some of those antidepressants and anticonvulsants as well. So they can give you a little bit more pain relief if we're looking at a combination of nerve pain and body pain. They're also a little bit less side effects in certain ways because of that, and a little bit more in others. So it's a trade-off, and it's something we have to decide between you and your practitioner who's taking care of your pain. Nabilone, I will discuss in just a few moments as we get into our medical and synthetic cannabinoids section of our discussion. But two major things about opioids are they can cause some severe side effects, including respiratory depression, and can ultimately lead to death if in an overdose situation. They can also cause addiction, but it is very important to stress that addiction is not the same as needing the medication to treat your pain. If you're using the medication at your prescribed doses and you need an increase, get an increase. That's okay. That does not mean you're addicted to it. That means that you need more medication to treat your pain, and that's quite common with opiates. Your body will become settled with it, and then you'll need a higher dose to treat your pain. That's called tolerance, and it's a completely separate discussion from addiction, which involves a host of factors. It's not just about needing a higher dose to treat your pain or feeling some withdrawal-like symptoms if you don't have your medication, which is common in opioids. It can also cause some constipation, drowsiness, dry mouth, dry eyes, and nausea. When we're looking at our opioids, those are things like codeine and fentanyl and oxycodone and hydromorphone, morphine. They come in both short and long-acting versions. And we use these for really two different reasons. Our short-acting ones we use for either acute pain, you broke your leg, you had surgery. We need to give you some medications to help control your pain. We also use them if you're on a long-acting opiate, which we'll use for chronic pain. Cancer is one of the big ones. Cancer can be very painful, and it's quite common for patients to be on high doses of opioids to help with their pain as they're going through cancer, not just the treatment, but the actual disease as well. And we'll give the long-acting version, but we still are going to expect to see breakthrough pain where that long-acting is just not taking care of it. So then we'll give a short-acting version to help treat that kind of breakthrough. These medications come in a variety of forms. They're available as patches, tablets or films that you dissolve under your tongue, capsules, tablets, liquids, like a medication you drink, as well as intravenous or intramuscular injections. Those last two are usually given either in hospital, in hospice, or if you have significant pain and you have home care coming in to do it. Those are when we'll often see those versions, the IV or the IM, used. But it's important to know that we can navigate the pitfalls of opioids safely. We know that it's been, this class of medication has become the poster child for the addiction crisis that is sweeping our country. And that is very true, and we need to be treating that. But they do work for pain, and they do still hold a very important spot in our arsenal to treat pain. We've had to change how we approach using them, but that doesn't mean that if you're given one, you shouldn't take it, because we're giving it to you to help treat that pain. When we're looking at the kind of common side effects of it, constipation and the dryness, the dry eyes, the dry mouth, vaginal dryness, all can occur. Those are all things that we can treat with over-the-counter products. Mouthwashes that help rehydrate your mouth. There are eye drops that are wetting agents that will just help lubricate your eyes and prevent that from bothering you. I do want to, when we're talking about the dryness though, point out that even though you're gonna feel thirsty, it's not just a lack of water that's causing that dry feeling. In fact, drinking too much water when you're on one of these medications because you're just feeling that dryness can actually make it worse. It's because the enzymes that are in our saliva, the things that our saliva is composed of, aren't being produced. And so when you're drinking excessive water because of that dryness while you're on these type of medications, it does wash away what little your body is producing. And so that will actually make it feel worse. That's why we recommend the gels or the mouthwashes that are replacements for that, so that you're getting that hydrating feeling, not just getting the water that's washing it away. Constipation, if you're on long-term opioid therapy, is quite common. And we'll want to start you as soon as we're starting to really see you having any signs of it, or if we know you're going to be on it long-term, say you're a cancer patient, or you've tried everything else and you've finally found something that works for your pain, we don't want to take that away just because of a little constipation. We want to still treat the pain. So we'll do what we call a bowel regimen, where we'll give you medications, either laxatives, stool softeners, a combination of both, to take daily to help maintain your bowel regularity, because causing that constipation down the long road can cause other issues. Now, the big one that everyone wants to talk about is the respiratory depression that can occur with opioids. This is where we get that the picture of an overdose where someone's not breathing, they're unconscious. It's that respiratory depression that causes it. When we're looking, there is something that every single person can do if they find someone who's overdosing on an opioid, and that's use naloxone. You can get naloxone for free at any pharmacy in Ontario. But I really want to stress, because I have a lot of patients come in who say, oh, no, that's for addicts. That's for people who are abusing it. It's not. Yes, it certainly can help patients who are using opioids recreationally to keep them from having a fatal overdose. But it also helps if you drop your pill on the ground and your grandkid picks it up and puts it in his mouth because it looks like candy. It can help your 90-year-old mother with Alzheimer's who forgets that she already took a dose and takes another. Naloxone is not just about risky behavior. It's about human behavior. And we want to make sure that it's as available as possible for patients who are using these medications, either illicitly or by prescription, because every life saved matters. If you're concerned about it with a family member, if you say, you know what, hey, I'm listening to this presentation and my grandma's on a lot of pain medication. I wonder if she's got this because her memory is starting to slip. Or if you have pain medication, you're like, my 3-year-old grandkid is over all the time. I've got arthritis, that's why I'm taking it. I drop pills occasionally. What happens if your grandkid takes a dose meant for you? It's not just about overdose from illicit use or intentional overdose. These things can happen to anyone. So it's important that if you're concerned about it, stop in at a pharmacy and get a naloxone kit. It's important to know that naloxone only works temporarily. So as soon as you see someone who you think is having an overdose, the first thing you want to do before you do anything is call 911. Same as if you see someone in a car accident, before you go in to try and pull them out of the car, call 911. That is, everything else we're doing is a stopgap until they can get professional help. And that is why, first thing, always call 911, because this only will work temporarily. And it can, though, help save a life. If you give someone a dose of naloxone and 5 minutes later EMS gets there, that 5 minutes could be critical to preserving brain function or even just keeping them alive. When we're looking at naloxone, again, first thing, call 911. And then we're going to want to look and see if we really think it is an opioid overdose. And when we're looking at that, you're going to see someone who has blue lips, blue fingernails, because they're not getting the oxygen that they need. Their skin's going to be cold, it's going to be pale. They may not be breathing, or they may have very shallow, gurgly breaths. They may be hard to rouse, dizzy or confused, or even unconscious. If you see someone like this, it very possibly could be an opioid overdose. And if you've got naloxone on hand, basically it's available in 2 forms, an injection or a nasal spray. The injection has fallen out of favor a lot because people don't want to risk working with needles and drawing up a dose, especially your average person who's picking up a kit because they're worried about their grandma or their grandkid or their friend who they know recreationally uses opioids. The nasal spray is a lot safer. You basically take it out of the package, shove it up their nose, and push down. One thing to note, though, is that if it is an opioid overdose, they are going to rouse very quickly if they will rouse, and they are going to be very angry. It's not about them, it's a chemical reaction with how the medication works. But it is important to know, too, that naloxone, if you give it and it's not an opioid overdose, is not going to hurt. It only works on opioids. That is the only thing it does. So if it's not an opioid overdose, It's not going to cause any harm, and it's still better to give than not. And some opioids, especially a lot of the synthetic ones like fentanyl and methadone, may require multiple doses of naloxone to help treat it, which is why every naloxone kit that's provided in Ontario comes with 2 doses, one to use right away and one to use in 5 minutes time. But you may say, well, okay, what if I get this and I use it on someone? What's going to happen? You know, am I liable for if something happens to them? And the answer to that is no. In Ontario and Canada, we have 2 acts that help to protect people from liability if they do something like this. The Good Samaritans Act of Ontario, which was brought into law in 2001, protects anyone from liability except for if they have something that's either a willful act to harm someone or considered gross negligence if they act or fail to act. So if you see someone and you don't do anything to help them, you're just as not liable as if you see someone and do something to help them. And that's for anyone who provides medical emergency assistance in a medical emergency to anyone who is ill, injured, or unconscious if you're doing it at the scene of where you find them. So you can't drag them 5 blocks away and then start. But if you see someone who's in a medical issue and you act, you're not liable for any damage that you may unknowingly do while trying to save them. And that covers naloxone as well. The Good Samaritan Drug Overdose Act is a federal law, and that protects anyone in an overdose situation, whether you're with them, whether you are the person who overdosed. And this one is more from a legal point of view. It protects you from being charged under the Controlled Drug Substances Act for simple possession or for a breach of a pretrial condition or a probation condition for having just having the drug on you. It doesn't protect you if you're being charged for, trafficking or production, but it will protect you. So if you do see someone and you're with someone who's using recreationally, still call 911. You are protected from liability from that by federal law in order to, again, it comes down to saving a life. That's what we're looking at doing. That's why these things exist. So medical cannabis is becoming more and more popular, both here in Canada and down in the USA. It's being legalized recreationally. It is recreationally legal in Canada, and various states in the US are legalizing it recreationally, and a lot of them have legalized it to use medically. It has a lot of compounds that are being studied for pain. There's about 100 different cannabinoids in cannabis. I'm not going to cover all of them because we'll be here for another couple of hours. The big ones are THC or tetrahydrocannabinol or CBD, which is cannabidiol. Those are the 2 major ones, but there are a few others that are being looked at for treatment of pain. Now, it's important to note that medical cannabis or even recreational cannabis does not necessarily mean it comes from the marijuana plant. Your cannabinoids can be derived from hemp or from marijuana. And the legality in different jurisdictions depends on where it's derived from. What we want you to watch out for, though, is if you are using medicinal cannabis, most commonly medicinal is the derived from marijuana, whether you're smoking it, eating it, inhaling it, using the oils under your tongue, we want you to really make sure you're checking with a pharmacist because these substances do interact with other medications. And you can lead yourself down a road where if you have started using cannabis to treat your pain or for any other reason, it may impact your blood pressure medications or your other pain medications. And you may end up actually causing yourself more harm than good if you're not checking to see what it's interacting with what you're taking. Food is another important factor for ingested cannabis products because the changing in how you take it, empty stomach versus a high-fat meal, can change the absorption of it and change how it affects you. As with other medications, the cannabis does have side effects. I know everyone says, well, you know, it's herbal, it's natural. Well, so is arsenic. Um, it's still got a lot of good therapeutic value, but it does have side effects. The THC heavy products can cause paranoia, can cause respiratory depression, and dizziness, drowsiness sort of thing. Um, but if you're using it in appropriate therapeutic doses, we can help manage those. Our prescription cannabinoids, now these are ones that have been available in Canada and the US before the legalization of cannabis itself. So these are synthetic ones that are made in a lab for a specific purpose. They're broken down into three different categories. Your THC-based ones, which are nabilone and dronabinol, which dronabinol is not available in Canada, only nabilone is. But these ones we really use to treat cancer pain, as well as nausea and vomiting in cancer patients or chemo patients, and to help with weight gain in that population as well, because, well, the side effect of marijuana, as anyone who's partaken as a wild youth will tell you, is the munchies. And that happens with these synthetic ones, and that's how we use it to help patients gain weight. It does help a lot with pain as well, the THC-based versions. I'm not going to cover the CBD cannabidiol or the Stativex as much because the cannabidiol is not used for pain at all. It's only used to treat certain types of seizures. Stativex is relatively new, just recently approved in Canada. It's been used in the European Union for a few years before that. But it really is a very narrow use, and that's for pain and spasticity in patients with multiple sclerosis. That's its only approved indication, and that's the only place it's been seen to have any kind of benefit. So it's not really applicable to most patients. Anyone who's using that will have gone through a specialist for a number of years before reaching that medication. Lastly, we have therapeutic exercise, and by no means am I an expert on this, as I am on the drugs, but they have a lot of value in pain. Yoga, Tai Chi, swimming, and walking are the big ones that we use. And they've been demonstrated in studies to help with different types of pain. So yoga has been shown to reduce pain from arthritis, as well as low back pain, fibromyalgia pain, and migraines. Of course, when you're first starting out with yoga or Tai Chi, it's important that you make sure you're physically able to do the movements, and that you're kind of learning them from someone who knows what they're doing and not just watching a YouTube video at home trying to figure out what to do. And that's because if these movements are done wrong, they can cause worsening of pain or dislocation, or you may end up falling if you try something too complicated in a yoga pose. And depending on how your bones are, you could end up breaking something. Tai Chi has been shown to reduce pain from both osteoarthritis and rheumatoid arthritis, as well as fibromyalgia, tension headaches, and other forms of chronic pain. And I'm just going to say, especially because the Kingsville Community Center is helping us put on this presentation, they do have an excellent Tai Chi program that they run out of the main community center twice a week, I believe it is, but drop into the center to find out information on that. It is really a fantastic program. When we're looking at swimming and walking, we're not really using those directly for therapeutics, but they strengthen the muscles, which can really help with a lot of that somatic body pain, especially osteoarthritis and other types of joint pain. But doing those exercises, doing other exercises if you're already in pain, can be complicated because you're going to hurt more, and that's not what you want to do. You don't want to hurt more, you want to hurt less. That's why you're doing it, which is why swimming and walking are two of the really great exercises you can do because they're very low impact. Swimming especially, or even if you just get in and tread water, do a couple of brick lifts. They have exercise aquafit classes that you can take at community centers and pools all over the province. And they're really low impact because the water takes out so much of your weight. You're buoyant. You're not feeling, I'm not going to feel if I'm in the pool all 230 pounds of me on my knees. And so that relieves some of that pain and lets you strengthen those muscles without worsening the pain. And that is all I have for this evening. Next time, we will be discussing a variety of different mental health topics. That will be December the 12th, back here at Unico Hall at 6:30. And the reason I really like to talk about mental health in December is because we all get those Christmas blues. Seasonal affective disorder comes out. You see a lot of people, elderly patients who don't have any family around. People have lost a loved one. The season that should be cheerful for so many people is not. And so we want to discuss how you can support your mental health, especially during those times. Now, what we talk about will be applicable year-round, but that's really why I like to put my mental health talk in December. So with that, I'd like to thank you all for joining me. And if you have any questions, please feel free to ask them here tonight, or stop into our pharmacy at 200 Main Street next to the high school and ask away. And thank you very much.